Hey everyone, hope you're having a great day. You're listening to the RX Daily Dose. Today's episode is being recorded for Monday, November 14th, and I'm your host, Ian Parnagoni. We update this podcast for healthcare providers, medical professionals, and anyone who has an interest in drug updates. Don't forget to like, share, and subscribe on all your favorite podcast platforms and social media, including iTunes, Spotify, YouTube, and Instagram. All links can be found in the show notes below. So this week, just two updates for you. First, a review of the current situation regarding what the media has labeled as the Tripledemic, and then a warning issued by the FDA related to certain illicit medications being laced with other sedatives. As always, feel free to skip around. I'm going to include times in the show notes so you get the updates that interest you. So first up this week, the FDA put out a warning to healthcare providers related to possible xylazine inclusion in fentanyl, heroin, and other illicit drug overdoses, as naloxone may not be able to reverse its effects. The FDA is aware of increasing reports of serious side effects from individuals exposed to fentanyl, heroin, and other illicit drugs contaminated with xylazine. Xylazine is FDA approved for use in animals as a sedative and pain reliever. Xylazine is not safe for use in humans and may result in serious and life-threatening side effects that appear to be similar to those commonly associated with opioid use, making it difficult to distinguish opioid overdoses from xylazine exposure. However, we do not know if side effects from xylazine exposure can be reversed by naloxone. Since we do not know if reversal agents regularly used in veterinary medicine are safe or effective in humans, they should not be used. Routine toxicology screens do not detect xylazine, and additional techniques are required to detect xylazine when it might be involved in illicit drug overdoses, particularly when there are other signs or symptoms of xylazine exposure. Healthcare professionals should continue to administer naloxone for opioid overdoses and consider xylazine exposure if patients are not responding to naloxone or when there are signs or symptoms of xylazine exposure such as severe necrotic skin ulcerations. Healthcare professionals should provide appropriate supportive measures to patients who do not respond to naloxone. The FDA issued a letter to stakeholders providing clinical information about the risks of severe necrotic skin ulcerations from repeated xylazine exposure, possible withdrawal symptoms, and xylazine's interference with successful treatment of opioid overdoses. It is not known at this time whether the xylazine used in these scenarios is illicitly produced or diverted from the animal drug supply. The FDA is continuing to investigate the source of xylazine in the illicit drug supply and will provide an update when new information is available. And finally this week, you've probably seen some of the media attention over the last few weeks about what they call the Tripledemic. With the currently circulating Omicron COVID variant, a rise in the number of influenza or flu cases, and an increase in pediatric hospitalizations for RSV, many hospital systems are overwhelmed and at capacity, especially pediatric units. Let's get some basic seasonal virology done first and then a review of RSV. Most years, it's a similar story. As soon as it starts to get cold, people gather indoors, windows are shut, commuters forego walking or cycling and opt for packed buses and subways. Our whole world retreats to where it's warm. We as a people create the perfect breeding ground for viruses. When the respiratory virus season begins, it's usually quite predictable because of this. Patients start being admitted to hospitals with influenza or respiratory syncytial virus around October in the Northern Hemisphere. Thousands of people get ill, and some may die, but the odd extreme year aside, health systems across Europe and North America aren't typically at risk of being overwhelmed. This year, however, we're seeing many hospitals in the US already at capacity, caring for a large number of children infected with RSV and other viruses, many more than would be expected at this time of year. The U.S. Centers of Disease Control and Prevention doesn't track RSV cases, hospitalizations, and death as it does flu, but hospitals across the country have been reporting peak levels that are typically observed in December and January. Nearly 1 in 5 PCR tests for RSV came back positive in the week ending October 29th, with this rate having doubled over the course of a month. Generally speaking, the higher the proportion of tests that come back positive, the more common a virus is in the community. In the 3 years before the pandemic, an average of just 3% of tests came back positive in October. This too is sort of our own making as well. Over the past 2 years, RSV and flu were kept down thanks to the protective measures people took against the coronavirus: mask wearing, hand washing, and isolating. Between the beginning of the pandemic and March 2021, the weekly positivity rate for RSV tests remained below 1%, according to the CDC. That's down from where it was in pre-pandemic times. In July of this year, health specialists warned in The Lancet that the benefits of these pandemic precautions could end up having a negative effect this winter season. Reducing exposure to common endemic viruses such as RSV and flu, experts argued, risked creating an immunity gap in people either born during the pandemic or who hadn't previously built up sufficient immunity against these viruses. RSV, or respiratory syncytial virus, is a common respiratory virus that usually causes mild cold-like symptoms. Most people recover in a week or two, but RSV can be serious, especially for infants and older adults. RSV is the most common cause of bronchiolitis and pneumonia in children younger than 1 year of age in the US. Now, mind you, RSV is so widespread that almost all children will have had an RSV infection by their second birthday. Since these children have been isolated, masked, and don't have immunity, we're seeing increased numbers of RSV infections and increased severity in some cases. Like other respiratory viruses like influenza or COVID-19, symptoms of RSV infection usually include runny nose, coughing, sneezing, fever, decreased appetite, and wheezing. The symptoms usually appear in stages. In very young infants, the only symptoms may be irritability, decreased activity, and breathing difficulties. Those infected with RSV usually show symptoms within 4 to 6 days after being infected. Healthy adults infected with RSV may have few symptoms but can still spread virus to others. Individuals infected with RSV usually are contagious for 3 to 8 days, and recovery usually takes 1 to 2 weeks. However, some infants and those with weakened immune systems can continue to spread the virus even after they stop showing symptoms for as long as 4 weeks. There is no vaccine for RSV. So what can you do for the flu, RSV, COVID season? Follow some basic prevention guidelines, including cover your cough and sneeze into your clothing, not your hands. Avoid close contact with others who are sick. Avoid touching the face, particularly the eyes, nose, and mouth. And wash your hands frequently. And finally, get your influenza and COVID-19 primary series and booster vaccination. And that's all I have for right now. I hope you enjoyed today's episode. I'll include all links in the show notes below, so please go back and check those out too. Please connect with me on any of your social media platforms and give me feedback on what you heard today. I'd love to know what you thought about the episode. And as always, feel free to like, share, and subscribe wherever you listen to your podcasts. And thank you so much for tuning in. Stay safe out there, and I hope you enjoy the rest of your day.